Hi there, my name is Gerard Green. I'm a men's health physiotherapist in the United Kingdom, and I'm just back from teaching my men's health physiotherapy course in Ireland. And I'm really excited about working with Jan and his colleagues at Myopain Seminars. So I'll be coming to Washington in early July, and it's really exciting because we're going to do a 3-day men's health physiotherapy course. So we're going to look at some male anatomy in a lot of depth. We're going to look at really the scope of men's health physiotherapy, or physical therapy as you see in the States. Going to go into how to assess these patients, how to ask those sensitive, difficult questions, and how to get used to doing that and really getting good quality information from the patient. We're also going to have a good look at male pelvic pain, to also include athletic pelvic pain, hard flaccid syndrome, and also those men who are getting loads of pelvic pain with urinary symptoms, bowel symptoms, ejaculatory pain, erectile dysfunction, who've also got quite kind of marked emotional, cognitive, behavioural components. We're also going to look at hard flaccid syndrome in a lot of detail. Hard flaccid syndrome, it's almost like a sympathetic type condition where people are getting some kind of atrophic changes to the penis, where they're getting a lot of erectile dysfunction in association to some actual tissue changes around the penis. So we'll do that as well. We're also going to look at the role of physiotherapy in the post-prostatectomy patient. And a lot of those men get a really tough deal. You know, they've gone through the trauma of being diagnosed with prostate cancer. They have the surgery, but then suddenly a lot of them are left with quite marked urinary incontinence and erectile dysfunction. And we had some brilliant news today about the course. We are going to have Prometheus come on board. So Prometheus work with one of the US's top pelvic health physiotherapists, Ramona Horton, and through kind of Ramona's work, Prometheus are going to come to the course in Washington, and that means that we will get to use their ultrasound units on the course. And I love doing this because this is what I do clinically. This is what we did in Ireland also. So we can use the ultrasound units to really see what's happening to that pelvic floor, and what we can do for the pelvic floor for the patient with pelvic pain, if it's maybe overactive. The patient maybe with erectile dysfunction, we want to get it working but not too much, and the patient who's post-prostatectomy, we really want to work that fast twitch, slow twitch pelvic floor muscles a little bit more, but really in functional positions, getting them off the plinth, getting them training a bit more. And the ultrasound is really beautiful for doing that. So we're going to use a lot of transabdominal ultrasound. We're going to put that probe on that man's tummy, and we're going to see what's happening to the base of that bladder, to that pelvic floor. So I'm really excited. I haven't taught in the States before. I have huge respect and admiration for Jan. You know, I've kind of grown up reading a lot of his textbooks, papers. So it's brilliant to work with him and his team. It's amazing to work with Ramona. We love Ramona in the United Kingdom and Ireland. She comes over here to teach, especially her visceral course, which we love. And if you want any details about the course, because I don't think it's full, but it's getting there. And I think Prometheus coming aboard has given us real momentum, even more momentum. So if you look on Jan's website, which is Myopain, and any queries, you can tweet me at Gerard Green PHY, that's Green with an E on the end, or you can find me on Facebook at Harborne Physio, or on Instagram at Harborne PT. And any questions you have in the course, myself or Jan are happy to field those and answer those. But you know, the men of your community will thank you for being able to help them with whether it's pelvic pain, whether it's erectile dysfunction, whether it's athletic pelvic pain, whether it's post-prostatectomy, whether it's maybe post-colorectal dysfunction, and thank you for listening.